Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
I'm Dr. Kulvinder Saini. I'm a practicing ENT surgeon in Ludhiana. My clinic is in 21A Rajguru Nagar. My today's topic is what to do if someone falls because of vertigo. Let me discuss on this. Falls are one of the leading causes of injury and loss of independence, especially in older adults. And when vertigo is part of the picture, the risk increases significantly. Why? Because vestibular dysfunction affects balance, vision stability, and spatial awareness, the very system we rely on to stay upright. And this is not just about older adults. A sudden vertigo episode on a staircase, a mania's attack while driving, these situations are dangerous at any age. Today, we are talking about something patients are rarely prepared for: what happens if you fall and how to prevent it in the first place. Let's start with the basics. What makes people with vertigo more likely to fall? There are few key reasons. First, vertigo can come on suddenly, or so there is often no time to prepare. Second, many patients experience residual imbalance even between episodes. And third, fear of falling can actually change how people move. They become stiff and cautious, which can paradoxically worsen balance. So the risk does not disappear once the spinning stops. Exactly, the risk exists both during episodes and between them, which is why prevention is so important. Let's make this practical. Where do falls most commonly happen? Bathrooms are one of the highest risk areas, especially at night. You are getting up quickly, often in low light, and stepping onto the slippery surfaces. Stairs are another major risk. And then there are everyday hazards: loose rugs, cluttered walkways, poor lighting, and reaching for high objects. So it's not just the vertigo, it's the environmental interacting with it. That's why a simple environmental changes can make a big difference. What are the most effective changes people can make? If we start with the basics, use motor activated night lights, install grab bars in bathrooms, add non-slip mats, keep walkways clear and uncluttered, ensure good lighting, especially on stairs. These may sound simple, but they are highly effective. What about movement-related triggers? For people with position-triggered vertigo like BPV, it helps to cause pause at the edge of the bed before standing up. This allows the system to stabilize before movement. And for those with frequent or severe episodes, especially if living alone, having a medical alert system or easy access to help is a very practical safety measure. So the goal is to make the safer option the easier option. Now let's talk about what to do if someone actually falls. The first rule is don't rush to stand up, pause and check for injury. If there's head impact, severe pain, inability to move or bear weight, loss of consciousness, then if medical attention is needed before attempting to get up. If there is no serious injury, then take it step by step. Roll onto your side, come onto hands and knees if possible. Use stable furniture for support and stand up slowly. And if vertigo is still severe, it's safer to stay low and call for help rather than risk another fall. What if someone falls like they're about to fall? If possible, bend your knees and lower your body rather than trying to stand upright. But realistically, once a fall starts, the goal is reducing impact, not perfect control, which is why prevention is always more important than reaction. To summarize it, let's bring it all together. The three key takeaways: one, vertigo increases fall risk both during episodes and between them. Number two, simple home changes, better lighting, grab bars, non-slip surfaces, and clear pathways can significantly reduce that risk. If a fall happens, pause, check for injury, and get up slowly and safely or call for help if needed. Falls are not just accidents, many of them are predictable and preventable. And small changes can make a very big difference in the patient's life. Thank you. I think it will be give you more awareness about the vertigo and what to do if there is a fall. Thank you so much.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.